Hey everybody, Dr. Manzanares here. As promised, we have this video coming to you from board certified Dr. Lapenski. He's going to go through all of what the research says about migraine headaches in NUCCA care. So I hope you enjoy this content.
Did you know that almost 1 billion people on the planet suffer with migraine headaches? And almost 40 million Americans do. Which is why today we're going to give you a little bit of information on people who've suffered with migraine headaches and a study that was done looking at a benefit that they've received from the ramifications of a board-certified NUCCA spinal correction. This study comes out of Canada, out of the Calgary Headache Assessment and Management Program, run by Dr. Werner Becker, and in conjunction with Dr. Gordon Hassick, a board-certified NUCCA doctor. In this study, selection criteria was used to pick patients who were part of this migraine headache study. All the patients were in the age range of 21 to 46 years of age. There were 11 participants and all had been graded or rated based on the board-certified neurologist and a system of categorization of migraine headaches. For study inclusion, the number of days that they exhibited a migraine headache in a month had to be for at least 4 months of duration. The average number of years that someone was a headache sufferer in the study, or the mean, was 23 years. So these are chronic or long-term migraine headache sufferers. And as far as intensity level goes, in at least 8 of those days that they had a headache during the course of a month, the intensity level had to be greater than 4 out of 10 on a VAS scale. Phase contrast MRI was used at the beginning of the study and during the course of the study, as well as disability impairment ratings taken looking at the impact of how migraine headaches had affected the patient. One of which, there were 5 main categorizations, but one of which was the HIT-6, it's the headache impact test. The next was the MIDAS, it's a way of kind of rating disability, looking at how much of an impact migraines have on people. And the MIDAS is the Migraine Disability Assessment Scale. The next step was the intervention. All patients were imaged using the NUCCA protocol done by a board-certified NUCCA doctor, Dr. Gordon Hassick, where the patients were measured for leg length inequality, they were measured for postural deviation, then they had pre-imaging taken, 3 views, a lateral, a nasium, and a vertex. Then from those images, data collection was obtained where we determined from imaging what the precise correction vector is for the patient and what the appropriate headpiece placement is. Using that information, the doctor made a correction to each patient and then took and measured each of those outcomes after, including post-imaging through X-ray. And now for the really interesting part. The thing that we're really looking at here was the impact on the number of days that the patients had headaches and the impact or the level of impairment to the patient's health. And so in the MIDAS testing that was done, the difference in all but 3 of the cases allowed for the impairment rating to be affected by over 50%. In other words, how significantly the patient was impaired by their migraines was changed by over half. So that's a substantial impact or alteration in their quality of life and the outcome. But also interesting is that the number of days that they had headaches was reduced by over 30%. So not only did they have a lot less headaches, the impairment upon their physiology was phenomenally less as well. And so this study's just really interesting because not only did it show that people who've been, chronic, a 23+ year migraine headache sufferer, and these are people that have been, clinically chosen to have a very complex case, the vast majority of the people had a massive change in the impact of how it affects their quality of life, as well as the number of days that they have a headache. So considering the large amount of people, again over 40 million Americans that have migraines, it's pretty amazing that such a exacting procedure with the correction of the skull, atlas, and neck done by a board-certified NUCCA doctor could have such a substantial impact. One of the doctors that was involved in the study said, this is truly amazing what we're finding. If we look at conventional treatments right now that are being done that we consider to be a little more cutting edge, which is Botox injections. If you guys were given a statistic or a coefficient and compared to that, that would be a 4, you guys would be a 10. The doctor said, if this information is as good as it is, which it's shown to be, if you were a drug, everybody'd be taking you guys who has a migraine headache. Most people don't even know what a board-certified NUCCA doctor is. However, you know, in studies, what we can see is the impact of the health and physiology on a person is profound. In this particular study set that was produced, what was found is that the impact of the NUCCA upper cervical correction had a more statistically significant impact than the most effective treatment methodologies that are available today. And yet nobody knows what we're talking about. And you know, I really think that that's one of the challenges that we face, is that most of the people out there who are suffering with migraine headaches, there's something that could be done to help them, and they just don't even know what's available. So if you're out there and you've heard this video, you've listened to it, and some of what I've published here, I would ask that you share this. I would ask that you get this out there. And if you know somebody who's had an issue with migraines, you need to send this to them. Personally, in my clinic, I've dealt with hundreds and hundreds and hundreds of patients, some with as long as a 70-year track record with migraines, where we've corrected them, we've imaged them, we've taken images after, and they're coming in and they're saying, I wish I'd have heard about this decades ago. And so commonly that's the case, where if you know somebody who needs help with migraine headaches, I would strongly encourage you, have them check out this video and check out our website, NUCCAWashington.com.